Hi, I'm Amy, and this is another edition of the Fascia-Informed Therapist. And today we have two guests. We have Caitlin Rambo, who you're all familiar with, and then we have Linda Walker, occupational therapist, retired, but is here for the week doing an intensive. And we're going to first have a conversation about the breast and chest workshop. Linda attended that last night, and we just want to talk a little bit about what that workshop is, why we created it, or why Caitlin created it, and how it went. So first, Caitlin, do you have any stats you can share about Breast Cancer Awareness Month?
Yeah, I mean, 1 in 7 women have breast cancer in the United States. About 60% of those women have complications with either lymphedema or limited range of motion or stiffness and pain, even months to years beyond their treatments or their surgeries, which we've seen in your practice. Mm-hmm. And then as a general fact, 70% of women have some kind of pain, tension, or discomfort, whether it's from stress, injury, breastfeeding, or a number of things. And so the breast and chest area is an area that we tend to not necessarily stretch or touch in a way that we would our shoulders or our hips or our backs as frequently. And so we thought, for a number of reasons, this workshop would really help a lot of people, even outside of Pinktober.
Yes, we've both treated a lot of women who are post-breast cancer, either not that far out or many, many years out, right? And I would say, in my experience, a lot of the women that have come to me have come because something has been bothering them, but they have really no idea that it's likely connected back to that surgery.
Yep.
Yeah. And then they have other things going on, like shoulder issues or hip issues, lack of range of motion, neck pain, TMJ issues, and again, not making that connection. And can we absolutely say it's due to that? But when there's no other real reason why those things are going on, it can absolutely be a contributing factor. Right? Yeah. Okay, so we talked about creating this specialty version of our regular self-treatment workshop, and Caitlin put the stretches together, the releases together, and it went really well. So tell us who ended up showing up last night.
Yeah, so we had us, including the 3 of us, and then we had a couple other people, which I was not mad about that we had a lower attendance for our first one, just to kind of get the kinks out, and just so that it felt more informal so people could feel more comfortable. So I wasn't mad about that at all. But we did have a woman who had a lobectomy and was actually wearing her lymphedema compression garment at the workshop. So that was interesting to tie that education in with what she still has going on, multiple years out since her surgery. And then we had another woman attend who, I don't remember how far out she is, but she had a double mastectomy without any reconstruction.
I want to say she said maybe 3 years.
Yeah,
am I remembering that correctly?
Yeah.
Okay.
Yeah, and then we had Linda attend. Do you want to talk about why you decided to attend?
Well, yeah, it was amazing to me because fortunately I've not suffered from breast cancer, but I have had an open heart surgery to replace valves. And as a result of that, it's impacted my posture, and my posture, I'm slumped over, and for probably most of that time, I will hold myself because it's uncomfortable most of the time. And it was amazing to me. In fact, I woke up this morning and said, this was the first morning in 4 years that I woke up and I did not have pain in my chest area. Normally I wake up and I have to put a pillow there and try and get pressure, but that pain was gone. Now I'm sure I need to continue some of the things that you taught me, but it was amazing. And I woke up this morning just feeling my body and thinking, that feels a lot better.
Yeah.
And then what else do you have going on in your chest area?
Well, in addition to that, I've had a pacemaker, and I got the gold standard pacemaker that is about this huge and about the size of 2 coasters here, and it makes it really, really difficult to wear a bra because I can't get a bra that's, the straps are wide enough that it doesn't just impede in that and hurt that. And it's like even the workshop on that, when some of the exercises, when we were doing the pulling and stuff, even resolved some of the pacemaker discomfort. And I've asked doctors, what can we do about that? That hurts and whatever. Oh, we can go back in and do surgery again, but it's not very productive.
Right. Well, and we had been talking about doing this workshop since I was a student, and so I think it was fun for me to think about the different stretches I would want to do. I have a picture of me brainstorming all the different ones and looking at some of the deep lines and different things like that. But it was nice to finally do it.
Yeah.
And finally get one under our belt and to have people, aside from Linda, but even in ourselves, in our own bodies, we're people who do a lot of myofascial self-treatment, but actually see the benefits for anybody, whether you are a breast cancer survivor or you have other chest issues, or maybe you don't, but you and I both found areas of our own bodies that we were like, oh, we didn't know that was there.
Absolutely. I have been told I have fibrocystic breasts and a lot of density over the years, and that has changed my choice in bra wear, but I would say I haven't really done any self-treatment, and I definitely found things. The other thing I noticed after the workshop is I tend to be kind of tight in my thoracic spine, and just from, I suppose, doing the work that we do, but it feels so much looser there this morning. I definitely felt like I did something yesterday, but I don't feel uncomfortable. It just feels, I'm more aware of that space than I was.
Yeah.
And if I could only add that I have some limited history in myofascial techniques and stuff that I've utilized in my own retirement practice. And so I already know some of the principles, but some of the exercises or releases that we did yesterday were amazing to me, and the differences in the types of balls and where we place them, and it was amazing to me. And I will take that home with me and carry it forward.
Yeah.
So we use the same balls that we use in the level 1 and level 2 workshops. So the 2 smaller, slightly denser balls that come in a little mesh bag together, and use those as a single ball and then together. But then we also use, it's like a 4 or 5 inch air-filled squishier ball. But then you added another ball that we haven't used in any other of our workshops, which was
most of them were 6 to 8 inches. And they were still, I didn't fill them up all the way, so they still had some give, but I feel like that really allowed us to, especially like for the thoracic mobility, or for a lot of people, the other balls, they either couldn't get a good angle, or they were still way too hard. And we know with fascia work of any kind, we want to be as firm as necessary, but as gentle as possible. And so utilizing a bigger ball and having a bigger surface area to allow for more of that compressed stretch was going to be more beneficial than maybe using the therapy balls and having it be too hard in those areas. And so we were able to use those, around the thoracic spine, around the diaphragm, around the pecs, in the armpits, and just a number of areas, because with all our other tools, it's kind of limitless the ways you can adapt things to get into different areas.
And I was meant to ask last night about the size of the balls. Are those balls based on your comfort level, or whether or not you talked about being gifted?
Oh,
and I'm not particularly among those who are gifted.
Yes.
So I kind of like the smaller balls.
Yes, I would say a couple of schools of thought. To answer that, no, it wasn't because I'm gifted, because I would not consider myself as gifted as others.
We're talking about breasts.
Yes.
For those who are not
size,
following or tracking what we're talking about.
Yeah, the utilizing a bigger ball was so that this could be better used like against a wall, for example, if somebody can get down on the ground, or to compress the majority of the pec region, or to get into the entire armpit. Not necessarily dependent on size.
Okay, I was just curious about
But Caitlin did help everybody do a little problem solving, because I think it was one time, Linda, when you had the bigger ball in your thoracic spine and laying on your back, and it was too much for you because it was too much, I think, for your neck. You don't have the flexibility in your thoracic and cervical spine. So Caitlin suggested you use the smaller air-filled ball, and I heard you say that felt great.
It all felt great. It was amazing.
Yeah. Okay.
But to kind of go back to what Linda was talking about, is another reason why we decided to do the workshop is because my mom in particular is a very gifted woman in the breast department. And I remember as a child seeing her struggle with, different bras and garments, and how much it impacted not only just her shoulder and her neck pain and her upper back, and on top of the breast pain. And a part of me now that I know what I know is thankful that I could give her those tools and resources so that she has them to use, so that as she ages and eventually, goes through menopause, and those things can hopefully help decrease that. So maybe she's not one of the 70% of women that has breast pain, even though she's already experienced that. If we can change that pattern moving forward. And I think that goes for anybody of any kind of size, right? Because it all impacts the whole rest of our body, whether we have, basketballs or whether we have peaches, right? Like it all.
Did you say peaches?
Yes, I did. I couldn't think of anything else off the spot.
I'm thinking golf balls.
Okay, sure. Golf balls. Right, but either way, it all has, Katie Bowman talks about this in her book and in her podcast, right? It all has an ability, and everybody has pain, whether or not they don't have a direct issue or not. Mm-hmm. Pain can happen in literally all shapes and sizes, and that's more the point that I'm trying to make with that.
Right, and there's so much fascia in the breast tissues, and we've had this conversation that from the moment our breasts start to form, we're told, here's your training bra, and we smash our breasts to our bodies, and that's not what they're meant to do. That's not what they're designed for. And we know when fascia is stiff and tight, it can develop problems with the tissues that it surrounds, and it can't function, and it's part of our immune system too, and we just develop all sorts of issues. So if we don't feel comfortable letting them swing and move like they're designed to, then taking the opportunity to do the work that you taught us to do last night is a good idea, to keep them healthy. Right. To keep them healthy and functioning as normally as possible.
So what I hear you saying is, even though you've not suffered from breast cancer or any kind of other chest surgery open, that class in itself could be very helpful to anybody who has some chest and or breast discomfort, despite having any medical procedure.
Or even anybody without discomfort. I mean, just being a woman and being used to wearing bras all the time. I mean, I've talked to women who even wear bras to bed, and they never get to swing. I mean, they're probably not wearing push-up underwears. They're probably wearing the lighter ones, right? But they're still wearing something to bed. And then, Caitlin, you talked about the new workout bras that are out there that you literally strap them across your body, and you're immobilizing your ribs and your thoracic spine, and then you're hiking them up and velcroing them, up as high as you can, I suppose, because that looks better, or they're out of the way to do your workout. I don't know,
and
but
people in my age group, it's like when we get home, it's kind of a contest who can get their bra off the fastest.
Yep.
Because we just want to get rid of it.
Yeah.
Because it's uncomfortable.
That's been a quest of my lifetime, is to find a bra
just
that's comfortable. And they're just, I feel like I'm always pulling or fidgeting or.
Right.
Well, another thing we talked about too is also just women and breastfeeding, right? And just how working on those areas, maybe even to prep for breastfeeding or while you are breastfeeding. I mean, there's so many things with clogged ducts and other things that cause that. But I'd actually seen a video a couple days before our workshop where women were having so much head and neck pain because they're pulling their shirt up and then holding it with their chin, right, and then doing their business, right, and how much that whole rounded forward was affecting everything versus taking, a claw clip that you normally use for your hair and have that be held here, and that way you can do your business without having to be so head forward. And I think just even women who are breastfeeding and in that phase of life, that could be so beneficial, and even weaning down, right?
For sure. Oh my gosh. I mean, I really struggled with clogged ducts when I was trying to breastfeed both my kids. And if I would have known what I know now, boy, that would have saved me a lot of literal pain and sadness, because I wasn't able to achieve what I wanted to achieve with my babies. The other thing I wanted to bring up too is some of the problems that we see post mastectomy or any kind of breast surgery, and I would say, I don't know how much therapy, Linda, you got after your surgery to teach you to move your arms again and feel safe with a lot of movement, but even today I hear from women who really didn't have their surgeries that long ago, I mean months or a year, that aren't getting post care of any kind. They're told just start moving. After so many weeks you can start moving.
Yep.
And we see women who hold their arms across their chest because they're just sort of, even though maybe they've had some reconstruction or they're wearing prosthetics, they still feel this difference, and it shows up in their posture. They just or they're still scared to lift their arms over their head or lift heavy things, and they're just not taught that they need to take their arms through that full range of motion and twist through their spine in order to maintain that. And the results of the surgical incisions is pulling into the fascia in so many different directions. It just blows my mind that we're not getting that post-surgical care in the way that women need it.
And my physician ordered cardiac rehab. And when I started investigating what cardiac rehab was to have a nurse put me on a treadmill and see how far I could go on the treadmill without having heart problems. And knowing enough about occupational therapy and knowing about the whole body, I had 3 sessions and I said, I'm done with that. I want to do some therapies that's going to work with the whole body. And because I'm a golfer, I was lucky enough to get involved with, the occupational therapist was a new grad, and really where I was in a small town was not able, and I got involved with the physical therapy, and so he did a lot of work with me about raising my arms and moving everything, and a lot about my golf swing. So it was very much productive.
Yeah, but you had to seek that out.
I had to seek that out, and I had to direct. I mean, I did a lot of direction about this is what I want to work on.
Okay.
And most people don't know.
And most
that's
people
an
don't.
option.
Right.
If the fact that I had the occupational therapy background, I was able to direct those areas that I thought were my deficits.
Right. Yeah. I mean, do you want to tell your one story of the spiral line?
Oh, yeah. That's always a good story. So in the world of fascia, there's some thicker lines. If anybody who's listening knows about Tom Myers and his anatomy trains, there's some lines of fascia that are a little bit thicker. They attach down in different places, and they have a functional purpose in the body to protect us and limit and support movement. So there's a spiral line that starts there's 2 of them. One would start on the right armpit, cross over the center of the body, and go all the way down to the left foot. And then there's, of course, one that is the opposite of that. And I had a client several years ago, maybe about 7 now, who came to me and said that we went through her whole evaluation, and she said, okay, I got to tell you one more thing, but I know this is wrong. I know it's weird. But I feel like I just need to tell you that, she says, I have this pain from my left armpit that crosses over and goes all the way down to my right foot, and my foot hurts all the time. And I pulled down my posters off the wall of the spiral line, and I showed it to her, and she started to cry. And she was like, wow, I can't believe that you believe me. And she said, I've typically when I talk to any other healthcare providers about that, they dismiss it, or some have even offered her medications because they feel like there's something wrong with her thinking, or she must be depressed, or something's that's just not normal. There's no muscle that goes there. So it must not be possible. There's no nerve that would answer that question. But the fascia answers that question, validated her experience. And when we worked on those spaces for her, especially up in the chest area, that released the sensation of pull into her foot that caused the pain. And that I'd give myself goosebumps every time I tell that story, because it's just that's the whole reason that I'm doing what I do, because it answers so many questions for people. And I think it's so important that more therapists understand the science of fascia and learn techniques that they can use hands-on and hands-off, like with our self-treatment, to teach people what they can do to help themselves. And we can empower people, because now Linda's going to go back to Arizona, where we won't be there all the time to help her, but she's got tools now, right?
Yep.
Yeah.
Yep.
And you're going to come and do a workshop in Arizona.
I hope so. Okay, so Caitlin, the last thing I wanted you to talk about, unless you have anything else, is when we did the workshop, you started with the feet.
Yes.
We were nowhere near the breast or the chest.
Yes,
So talk about that a little bit.
I started at the feet for a few different reasons, but all of those deep lines that Thomas Myers found and talks about in his books, they all run to an extent through the foot, or at least most of them do.
They can, converge down there.
Yes, and so point A being, a lot of the stuff going on in the chest can also be due to compensating postures. And a lot of times, depending on how we're stacking ourselves up against gravity, specifically if our weight is in our heels or not, would impede or hinder the ability to have good neutral postures. And so if we do have stuff going on in the chest, it could be stemming from something all the way happening in our feet. And so that's why I wanted to start there. It's also a good way to teach people the principles with the long slow holds and the gentle pressure and different things like that. But then also we have the retinaculum that's across the front of the ankle. And the retinaculum is the most highly innervated section of fascial tissue in the entire body. Right?
Yep.
And I'll say that one more time for the people in the back, is the retinaculum across the top of the ankles is the most highly innervated section of fascial tissue in the entire body. And so working in areas that directly correlated to that retinaculum can help with whole body issues. And I would say everybody in that room yesterday found something in their foot. Maybe they didn't feel it directly into their chest, but they found something in their foot, and they were able to move a little bit better because we opened up. Because we relieved some of the tension in the body, we opened up more full range of motion of the joints throughout, the rest of the legs and the spine and the hips, which allows them to have better movement and healthier joints. And so I'm sure I confused a couple people.
Increased flexibility.
Yeah. And I'm sure I confused a couple people because they came for a breast and chest workshop and we started at the foot. So hopefully I explained that well enough to them so that they would know that. But those are a couple of the reasons why, and for some people that don't have, a half hour and a half at the end of their day to do self-treatment in multiple areas, sometimes working in the feet can give you the most bang for your buck.
Yep. And it's easy to do when you're standing and doing a lot of other ADLs you'd be doing at home.
Yep.
And then I guess lastly, one of the women that was there had come to the level 1 workshop, and so it had some familiarity, and then the other woman had never been to any of our workshops before, but had said that she would like to come back. And Linda, you've done the level 1 as well. So what I want people listening to know is that we have a class that will teach you how to do these workshops. You do not have to be a myofascial provider. You don't have to have any hands-on myofascial training to be able to learn how to teach someone to treat themselves. If you are a OT practitioner, PT practitioner, you can teach somebody how to use these balls and apply these principles and create workshops that will help either like what we did yesterday or any other specific diagnosis. The therapists are the expert in those diagnoses. They know the ideas, but we can teach you the principles of the fascia, the science of the fascia, and then how to use the principles with the balls. The primary thing is gentle.
Yes.
There's way too many. I still get way too many clients who come in and say, oh yeah, and this therapist gave me lacrosse balls and showed me to do this. And gentle, gentle, gentle is what the fascia needs and responds to.
And to add to what you're saying too, we have OTs that have learned about fascia and have these tools in their practices in rural Nebraska and here in Omaha and many other places that don't necessarily do myofascial work with every single person they see, but they teach them how to use those, especially for those in the breast and chest areas, but even just whole body, because they have a deeper understanding of fascia and how it can be applied to some of their patients. They then can teach them for self-care or for even ADLs and all these other things that we would bill for in traditional practice, how to use these tools to better their body. And that is the bottom line.
Yes, yes. Linda, anything else?
Consistency over intensity.
Oh,
I'm so proud.
Excuse me. I'm sorry. That has been drilled into me.
I love it. Thank you so much for saying that. You made me proud.
I'm trying not to tell stories.
Okay, all right. Thank you, Caitlin. Thank you, Linda.